Today, in FDA approval in breast cancer, breakthrough therapy designations in AML and bladder cancer, and highlights from the 2016 Multidisciplinary Head and Neck Cancer Symposium. Welcome to Enclave News Network. I'm Gina Columbus. The FDA has approved palbociclib for use in combination with fulvestrant in pretreated patients with HR-positive, HER2-negative metastatic breast cancer. The approval is based on data from the Phase 3 PALOMA-3 trial, in which the combination more than doubled progression-free survival in this group of patients. Palbociclib was found to delay disease progression by nearly 5 months. The overall response rate was 24.6% for the palbociclib arm, compared with 10.9% for the placebo plus fulvestrant arm. The duration of response was 9.3 months versus 7.6 months, respectively. The FDA initially approved the agent in February 2015 for use in combination with letrozole as a frontline treatment for postmenopausal women with ER-positive, HER2-negative metastatic disease. The FDA has granted the multi-kinase inhibitor midostaurin a breakthrough therapy designation for newly diagnosed adult patients with acute myeloid leukemia who harbor the FLT3 mutation. The breakthrough status was based on findings from the Phase 3 RATIFY trial, which randomized patients to standard induction and consolidation chemotherapy plus midostaurin. In the study, the addition of midostaurin reduced the risk of death by 23% compared with chemotherapy alone. After censoring patients who received stem cell transplants, the overall survival benefit with midostaurin remained steady at 25%. There are not currently any approved targeted therapies for patients with AML. The current standard of care for this subgroup of patients is combination chemotherapy. Studies continue to assess midostaurin for patients with FLT3 mutated AML, including in a Phase 2 study for newly diagnosed older patients. Novartis, the developer of the drug, plans to submit data from the study to the FDA within the first half of 2016. A second breakthrough therapy designation was granted to durvalumab as a potential treatment for patients with PD-L1 positive, inoperable, or metastatic urothelial bladder cancer following progression on prior treatment with a platinum-based regimen. The designation is based on early findings from a Phase 1 study that explored the immunotherapy across several solid tumors. Findings from the urothelial cancer arm of the study have not yet been released. However, data were submitted for presentation at a future medical meeting. Additionally, the Phase 3 Danube study, which launched in July 2015, is currently comparing frontline durvalumab monotherapy against durvalumab plus the CTLA-4 inhibitor tremelimumab, or standard of care chemotherapy for patients with metastatic bladder cancer. The primary endpoint of the study is progression-free survival with an estimated primary completion date of November 2017. The results of several studies were announced at the recent 2016 Multidisciplinary Head and Neck Cancer Symposium in Scottsdale, Arizona. One study showed that improved outcomes with second-line afatinib in recurrent or metastatic head and neck squamous cell carcinoma are associated with several biomarkers. The Phase 3 Lux Head and Neck 1 study randomized patients who had progressed on first-line platinum-based chemotherapy in a 2-to-1 ratio to afatinib or methotrexate. In the overall study population, afatinib significantly improved PFS by 0.9 months over methotrexate. Afatinib had more pronounced anti-tumor effects in terms of progression-free survival and overall response rate in patients with P16-negative tumors, tumors with EGFR amplification, and tumors with low HER3 expression or high P10 expression. Another study presented at the meeting showed that in patients treated with definitive radiation therapy for HPV-positive oropharyngeal squamous cell carcinoma, most recurrences can be detected via imaging at 3 months and physical examinations during the first 6 months after treatment. Patients experienced low rates of permanent toxicity, potentially because a multidisciplinary team delivered treatment. Minimizing post-treatment tests without compromising outcomes might reduce patient stress and financial burden. In a statement during the symposium, lead study author Dr. Jessica Frakes of Moffitt Cancer Center said, "The purpose of our study is really to determine when these patients fail and also when they have side effects, so we know how to guide our optimal follow-up schedule. If you look at the NCCN guidelines, it's a one-size-fits-all. So whether you're HPV associated or not associated, the follow-up recommendations are the same." A third analysis demonstrated that tobacco-associated mutations accumulate over time in smokers with HPV-positive oropharyngeal squamous cell cancer, resulting in less dependence on E6, E7, and other HPV-associated mutations. The differences in gene mutations related to tobacco use may explain why smokers have more aggressive HPV-positive cancer. And finally, on site at the meeting, Enclave spoke with Dr. Tang-Guai Saiwer of the University of Chicago Medicine on the potential of immunotherapy in head and neck cancer.
I think it's an exciting time for head and neck cancer currently because it looks like immunotherapy is quite active in this disease. We see a response rate of 20 to 25%, 1 in 4 patient benefits, and importantly, activity seen in both HPV positive and HPV negative tumors. And so we clearly have a new treatment modality in immunotherapy with PD-1 checkpoint blockade that looks like it has impact. But what's really important in addition, and I pointed this out in my presentation, is that what we really care about is survival. While response rates are nice, they likely underestimate the rate of benefit. When we look at preliminarily at survival outcomes, we have a median survival in a heavily pretreated population of head and neck cancer patients of about 10 months. That's almost as good as the extreme regimen or doublet chemotherapy in the first line setting. So in a much less favorable population, we see really good survival data. And combine that with the just announced positive phase 3 trial CheckMate 141 of nivolumab compared to dealer's choice, I think it's very clear that these drugs have a major impact on survival and likely will get approval, both pembrolizumab and nivolumab, I believe, in 2016. So I think it's an exciting time where a new treatment modality that's quite active is emerging.
Leaders in the oncology field are being recognized with the Giants of Cancer Care program. The program recognizes physicians and researchers who have devoted their time, talent, and resources to improving the care for the many patients and their families affected by cancer. Now in its 4th year, the program has been well received, with nearly 40 Giants selected so far. For 2016, 100 nominations have already been received, with nominations still being collected online. If you haven't yet, you can submit nominations at giants.enclave.com/nominate. That's all for today. Thank you for watching Enclave News Network. I'm Gina Columbus.